Prostate cancer is a cancer that begins in the prostate, which is an organ that's just below the bladder in men. Fortunately, it has a good cure rate if we treat it appropriately, and there are several good treatment options, one of which is brachytherapy. Prostate cancer nowadays is typically diagnosed via a PSA. A PSA is relatively new. When I first started 20 years ago, PSAs were just coming out, and most patients were diagnosed because they had big tumors that were causing symptoms or that you could feel readily on an exam. PSA stands for prostate-specific antigen, and in fact, it is prostate-specific. Nothing else makes it. A woman's PSA is 0. And men normally make PSA, but in the setting of prostate cancer, they make more PSA, or the PSA that is made has more ready access to the bloodstream and the levels are higher. There are 2 broad ways of giving radiation for prostate cancer. One we call external beam radiation therapy, and as the name implies, the source of the radiation is external to the patient. You lie on a hard, flat table, and the radiation is pointed at the prostate and surrounding tissues. In the case of brachytherapy, we, in the operating room, put the radiation directly into the prostate. With one form of this treatment, those sources stay there permanently, and with another form of the treatment, the sources are only there temporarily and give a very high dose quickly. If we do brachytherapy as the sole treatment, if you do high-dose rate brachytherapy as the only treatment for prostate cancer, then we do 2 different procedures, each of them 1 night stay in the hospital, and typically 2 to 3 weeks apart. As far as recovery goes, it's very rapid. For the type of brachytherapy that we do most frequently at Gamma West, patients are in the hospital for 1 night only. It's called high-dose rate brachytherapy. So for instance, if you came in on a Monday morning to the operating room and had the brachytherapy needles put in place, you would leave Tuesday afternoon. And it's really very common for men who are still working to go to work the very next day. Most patients with brachytherapy have very limited side effects. It appears that with high-dose rate brachytherapy, we have an excellent side effect profile and lower side effects in terms of urinary continence, in terms of potency, rectal damage, time to return to work. High-dose rate brachytherapy is very favorable in all of those regards. There are several good options for the treatment of many patients with prostate cancer now. With any of these treatments, the cure rates appear to be very similar at 5 to 10 year range studies. But the side effects are very different, and I think patients should, and most do now, pick treatments based on side effects and based on length of recovery, when they can return to work, when they can return to normal life.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.